Having one's symptoms dismissed by a healthcare professional is sometimes called medical gaslighting. This is a term which comes from Gaslight, a 1938 play which was later adapted into a movie. In the production, the husband manipulates the wife into questioning her perceptions of reality and her sanity. Signs of medical gaslighting. When a medical provider downplays or denies any symptom which is being described, this is a red flag the healthcare professional may be gaslighting the patient. Other phrases which may be a warning sign of medical gaslighting include, "It's all in your head," "Your pain is manageable," "You are just tense," "You are too young to be feeling," "You have got to expect this at your age," "All you need to do is lose weight," "It is just depression." Please note, providers do not always agree with their patients' proposed plans of action, but that does not necessarily equate to medical gaslighting. A doctor may not want to perform a specific test which the patient thinks he may need. The provider should take the patient's concerns seriously and explain why a certain test or treatment may not be appropriate. The patient should feel respected and validated. Feeling disrespected, trivialized, downplayed, or invalidated is another warning sign of medical gaslighting. Medical gaslighting protections. When going to appointments, it is advised to bring along a family member or friend who has witnessed the symptoms being described by the patient. It is harder to dismiss two people than it is to dismiss one person. The family member or friend can advocate for the patient. Keeping a diary and writing down symptoms as they occur throughout the day can be helpful. Additionally, having questions written down ahead of time will help a person remember his concerns and will also alert the doctor that you have put a lot of thought and effort into coming to the appointment. Having things written down conveys to the physician that the patient is organized and serious about the symptoms he may be experiencing. If a question is not answered, or if the answer given by the medical professional does not seem satisfactory, feel free to return back to the question. Moreover, take notes during the appointment. If a medical professional sees a person taking notes, he is much less likely to brush off your concerns if he knows everything he is telling the patient is being written down. Do not use an audio recording device without first asking for the medical provider's permission. In some states, there are laws which prohibit recording without the other person's knowledge or consent. Lastly, if the patient continues to feel uncomfortable, seek another opinion. It is important to not allow a provider's dismissive attitude deter a person from getting to the bottom of her medical issues. Where to find the right doctor. It may be helpful for a person to join a support group and ask members who they see for their medical needs. Finding a doctor who is knowledgeable about a medical condition can be a huge game changer in getting the correct diagnosis and treatment plan. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye!